Okay. Let's talk about depression, the Lilium syndrome. Many modern Chinese books often discuss depression syndrome as if it were identical to the depressive phase of manic depression. Many Chinese books, therefore, when giving the symptoms of depression, give the symptoms of Tian. This is unhelpful and not corresponding to clinical practice. The depression in clinical depression is quite different from the depression in bipolar disorder or manic depression from both a Western and a Chinese perspective. From a Chinese perspective, the depressive and manic phases of bipolar disorder are two poles of a pathological spectrum with the same pathology. Central to the pathology is phlegm obstructing the mind. This accounts for both the depressive and the manic phases of the disease. Phlegm obstructs the mind, but also the ethereal soul, so that it interferes with its coming and going, resulting in depression when it does not come and go enough, and mania when it comes and goes too much. By contrast, in depression, phlegm is not always present, and the coming and going of the ethereal soul is always impaired without the manic phase, resulting in a depressed mood, lack of inspiration, lack of a sense of direction in life, lack of life dreams and plans. The Lilium syndrome is described in the Essential Prescriptions of the Golden Cabinet, Chapter 3-1. This syndrome sounds remarkably like the description of a depressed patient. It says, the patient wants to eat but is reluctant to swallow food and unwilling to speak. He or she wants to lie in bed but cannot lie quietly as he is restless. He wants to walk but is soon tired. Now and then, he or she may enjoy eating but cannot tolerate the smell of food. He feels cold or hot but without fever or chills, bitter taste or dark urine. That is, it is not external wind or internal heat. No drugs are able to cure this syndrome. After taking the medicine, the patient may vomit or have diarrhea. The disease haunts the patient, who means fox and woe means bewildered. And although he looks normal, he is suffering. The pulse is rapid. Modern books describe the syndrome with the following symptoms, as if in a trance or absent-minded. Mental restlessness, bitter taste, dark urine, anxiety, depression, red tongue, which may be without coating, and rapid pulse. The treatment principle recommended by modern doctors is to moisten and nourish the heart and lungs, tonify qi, nourish yin, clear heat or empty heat, calm the mind, and strengthen the willpower. The points suggested by the book Chinese Acupuncture Therapy are as follows. Heart 7, kidney 3, lung 9. Heart 5, lung 7, kidney 4, spleen 6. Heart 9, pericardium 9, kidney 7. Bladder 15, bladder 13, bladder 23. Lung 7, kidney 6, liver 3. So to summarize, Lilium syndrome of Bai He Ping, the patient wants to eat but is reluctant to swallow food, unwilling to speak. He or she wants to lie in bed but cannot lie quietly as he or she is restless. He or she wants to walk but is soon tired, cannot tolerate the smell of food. He or she feels cold or hot, rapid pulse. Thank you for your attention.